So the first thing that I want to talk about is a new functionality that we have as part of our MedicLink abstraction platform, where abstractors now have the option to change the attending provider and primary provider attributed to the cases. So historically, this is a case attribution happens on the back end. So this is a data field that is populated by your IT team and sent to us in the monthly data files. And so when you see your physicians coming up in Tableau with those cases attributed to them, that has all happened on the back end in the data files. We know that it's imperfect, and so this is kind of in response to that. So now abstractors will have the ability to update that attending provider field or the primary provider field. And the primary provider field is inclusive of APPs, so your NPs, your PAs, residents, for example, so that you can see not only the attending that's listed on the case, but also the provider that's probably providing the majority of that care. And this is in direct response to some of the feedback that we've received from all of you, including our abstractors, clinical champions, administrators, in that Blue Cross Blue Shield of Michigan administered survey on our performance within the coordinating center. So one of the things, we're not always able to address the concerns that come up. This is one of those that we are. This is actually a suggestion from one of our partner sites a few years ago. It just took us a little while to figure out how to implement it to work in a way that doesn't increase abstractor time significantly on these cases and is also accurate. So that is a new option. And so what does that look like? So one example, you have a hospitalist that's listed as the attending physician in the case. Obviously, that's not something that is helpful for the purposes of QI. So now the abstractors could update that attending provider field to the actual ED attending rather than the hospitalist that came through in the data files. Another example, there was an attending provider in triage that briefly saw and assessed that patient, but the majority of the care was provided by a different attending within the department. In this case, the abstractors could change it to the attending provider that provided the majority of the care, or vice versa. And I think, again, like understanding all politics are local, the case attribution now is a little bit more in your hands, because oftentimes like the field that comes through is like the first attending on the case, for example, which the majority of time is probably correct, but not always. So again, this just gives you the option to update those cases as they come through. Third example, the primary provider is listed, it's the same. So the attending provider is listed, the primary, it's the same as the primary provider, but there was an APP on that case, there was a PA, for example. You could then update the name of that primary provider to the PA, and then you can find that information in Tableau later on. So these are just some examples. I don't have the ability to go through it in real time with you, but I will say, like, and we're going to go through relatively quickly, please email me if you want to look in Tableau at your data specifically on where to find this information. Because again, site-specific nuances there, but here's kind of the high-level overview. So the easiest place to find this information is going to be on the case list in any, the applicable performance metric that you're looking at. You're going to see 3 different fields: your attending provider field, your ordering provider field, and your primary provider field. Ordering, again, comes to us in the data files. Whoever submitted that order in Epic, Cerner, etc., comes through in that column. Sometimes it's going to be the same provider listed in all 3 categories. Sometimes they're going to be different. Example, there was a co-signing attending and then a resident on the case. And again, so sometimes you'll see they're different, and then sometimes you'll see that there's not an ordering provider, because in our utilization measures, there's not always something ordered. So for example, we'll say no chest x-ray or no head CT. And then sometimes there will not be an ordering provider column because, for example, in the chest pain module, there isn't something that is ordered. And then on those case lists in the bottom right corner, you have 3 different filters. So if you wanted to say, for example, pull up a PA's, all of their cases for the year, you could filter on the PA's name in that either the ordering or primary provider field and find that list of cases attributed to that PA. And again, we're hoping with this new functionality in MedicLink that those case lists are a little bit more accurate than rather just the data field that comes to us in the data files. Let's see, and then you also have the ability to export this data. I know a lot of our abstractors in particular do a lot of like data mining, data exploring from Tableau. I will add a list of the variable names that you'll need if you guys are the type of folk that like to mess with it in Excel a little bit. And if you ever have questions, again, please feel free to email me anytime. What this means for providers, this does not impact grading at all. We don't grade at the individual physician level anymore. It's really just for QI purposes. The kind of the guidelines that we've given to our abstractors for awareness, the attending provider field is the same. It has to be an attending provider. However, the primary provider field can be an NP, a PA, a resident, a fellow, etc. Sometimes the attending provider and primary provider fields are the same, and that's absolutely okay. Sometimes there's just an attending provider on the case. And then again, sometimes they will be different depending on, the functionality, flow, operations of your ED. Questions at all there? I know we've talked a little bit about this. Yeah. So it is technically live. So the abstractors are now able to edit those fields in MedicLink, and the primary provider field with the updated values are available in Tableau as of 2 weeks ago, I think. So it is a relatively new functionality where those fields can be edited. If you have trouble finding them at all or anything, please let me know. We can take like 5 minutes on a Zoom call and we can go through how to find those. Yeah.
Is it available just prospectively from now, or will we have some of that distinguishing between the providers looking back?
It won't be. So you do have, depending on the accuracy of those fields as they come through in the data files, you can see the historical cases as well. Just not, the abstractors didn't have the ability to update those fields until a month ago, starting in August, I believe. So you'll still be able to see if the data files that your site was sending included your APPs, for example, those are available on all the historic cases as well, just not the edited fields. Other questions? Okay. One more technical topic, again, probably not a new topic of conversation, but just wanted to reiterate it as we're all here together, related to our low risk chest pain measure and the HEAR heart score in particular. So just as a reminder, we calculate a HEAR score with the data abstraction module and use that calculated MEDIC score to determine whether a patient is considered low, intermediate, or high risk along with the negative troponins. And that is regardless of whether a provider documented a HEAR heart score. As was, briefly mentioned earlier, sometimes there's some discrepancies in the score that MEDIC calculates and the score that your providers are documenting. The majority of the time, almost 90% of the time, the MEDIC score is the same or higher or more conservative than the provider score, but about 10% of the time, there is the MEDIC calculated score is lower, which is meaning a little bit less conservative, and that's where we can run into issues. Only 1% of that 10% of the time were those cases actually falling into the performance measure or is potentially causing issues. So for example, a provider documents a HEAR score of 4, MEDIC calculates a HEAR score of 3. So a provider potentially admits that patient thinking they're intermediate risk, and they come into our measure because we calculated a risk score of 3. So that happens very, very rarely, again, but recognizing that when the numbers are low, because this is a sampled measure and our targets are high, one or two cases can make a difference in a site's ability to meet that performance metric. So we've talked with our sites, we've talked with the clinical champions, and we came up with a little bit of an intermediary solution here that we'll talk a little bit about. So if there's no provider documented HEAR heart score, we still will use the MEDIC calculated score. However, if the provider documented score is within 1 point of MEDIC, we will switch to using the provider documented score. So that protects us in those examples where we're calculating a 3, a provider's documenting a 4, or vice versa. It kind of protects us a little bit from not that we expect anybody to game the system, but it kind of like protects us in that respect. We're still focusing on the truly like low risk patients. And hopefully those 1 or 2 cases that are potentially making a difference in your all's ability to meet the target are no longer a factor. So it really allows us to focus on the true quality improvement opportunities, and we don't have to worry as much about those 1 or 2 cases that may come up, to haunt you in the end. This change will be reflected in MedicLink starting in December and will be available in Tableau starting in January. So it aligns with our new performance year. So the performance year currently that we're finishing up is going to stay the same. This functionality will be in effect for the 2025 performance year. Questions at all about that? I know we reviewed it briefly, and obviously if you have any site-specific questions, come find one of us or email us anytime.